Dr. Shannon M. Clark here. I'm a double board certified OBGYN and maternal fetal medicine specialist. And today I'm going to switch things up a little bit and talk about menopause. Just kidding. Menopause is not my thing. It's not my area of expertise, so I will not be talking or educating about menopause. However, I am going to talk a little bit about this account. Now, this account, Menopause Doctor, is by Dr. Louise Newsom, who is a general practitioner and menopause specialist from across the pond. Now, a few days ago, she posted this graph right here, and I'm not sure where she got this graph from because there's no crediting there, but it basically shows you what the hormone levels do during pregnancy and in the postpartum period. Now, in the caption on her post, she says that the hormonal changes that occur during the postpartum period are very likely to be the root cause of postnatal depression or postpartum depression. The reality is that we don't know the exact pathogenesis or cause of postpartum depression. We don't know exactly how postpartum depression differs from depression in those who are not pregnant or postpartum. Nor do we know if postpartum depression is a distinct subtype of depression. We do know that besides the hormonal changes, there are other factors involved in the development of postpartum depression. Now, what I want to talk about is this part of her caption. Hormone treatment should be considered as a treatment for postnatal depression, postpartum depression, as it is likely to be beneficial. Since I'm seeing more and more about hormonal replacement therapy for postpartum depression, I thought I would reach out to two experts in perinatal psychiatry, Dr. Nichelle Haynes and Dr. Kristen Lassiter. Let's see what they have to say.
We agree with everything that Dr. Clark said about postpartum depression.
Antidepressants remain the first-line treatment for postpartum depression.
Because when we're talking about using hormones for postpartum depression, we talk about two options, progesterone and estrogen. Progesterone, we do not have enough evidence to show that it could be an effective treatment for postpartum depression.
And estrogens really make some studies show that it might be helpful for postpartum depression when used with antidepressants, and some studies show that there's no evidence and no effectiveness with it in treatment of postpartum depression.
The other thing about estrogen is that it comes with really significant risks, including stroke.
And it passes through the breast milk, and we don't know what that does to baby. Also, it shows that it can decrease breast milk supply.
So let's stick with what we know and is effective.
There you have it, from two perinatal psychiatrists who are experts in the diagnosis and management of postpartum depression. Any use of hormone therapy for postpartum depression is purely experimental. So, a menopause specialist telling her almost 500,000 followers that hormone therapy should be considered for the treatment of postpartum depression because it's likely to be beneficial is pure conjecture. That same account didn't offer any evidence to support what they're saying or any evidence on the safety or efficacy of hormone therapy for the treatment of postpartum depression. In my expert opinion, if anyone suggests to you to take some kind of hormone replacement therapy or hormone therapy for your postpartum depression, that is dangerous and potentially harmful. So please be very careful.